Recently, Hu Yang, a doctor at Shanghai Lung Hospital in China, publicly stated that the hospital's organ transplantation business is rapidly expanding. His statement raised public concerns about the legality of lung sources and the high number of donors, drawing the international community's attention. Hu Yang, Shanghai Lung Hospital, performed over 60 lung transplants in 6 months. Hu Yang, deputy head of the respiratory department at Shanghai Lung Hospital, published a post on Weibo on July 27th titled, 3 lung transplants in 1 day, over 60 cases in 6 months. The freshness of the lungs transported by helicopter determines the effectiveness of treatment. The post explained, lung transplantation is the most challenging surgery within thoracic surgeries and is also the flagship specialty of the hospital's thoracic surgery department. The post highlighted that the hospital performed over 60 lung transplants in the first half of this year. Hu Yang also discussed various lung diseases of the patients in the posts, but it did not clarify whether the patients received single or double lung transplants. He also avoided addressing the sensitive topic of the official Chinese Communist Party CCP lung source. According to Hu Yang, currently, most lungs are transported by air due to the hospital's considerable distance from the airport and train station. Road transportation can be congested. Therefore, in most cases, lungs are first transported to Xiaoshan and Hangzhou, and then helicopters transfer them to the hospital. Regarding costs, he mentioned that the long-term collaboration with the helicopter company reduces the expenses to only 1/5 of the initial joint cost. According to Hu Yang, Shanghai Lung Hospital performed more than 60 lung transplants in the first half of this year, averaging over 10 procedures per month and at least 1 transplant every 3 days. Chen Jingyu, lung transplants every 2 or 3 days. In reality, Dr. Chen Jingyu, deputy director of Wuxi People's Hospital and a lung transplant specialist, often boasts of his achievements on Weibo. For example, on January 8th this year, Chen announced, "Today, the first double lung transplant of the Wuxi group in 2023 was successfully completed. The recipient had emphysema and respiratory failure due to COVID-19 infection and recovered." He added, "In Europe and the United States, lung transplants for late-stage COVID-19 patients are increasing." Chen's Weibo profile indicated that, aside from the lung sources obtained through donations, he frequently attends organ transplantation conferences, and suitable lungs for transplantation are consistently available. However, Dr. Chen has also acknowledged that China conducts extensive organ transplant operations, but the rate of voluntary organ donation remains low. As early as February 29, 2020, official CCP media reported Dr. Chen Jingyu's lung transplant team successfully performed the world's first double lung transplant on a pneumonia patient with COVID-19 infection in Wuxi, Jiangsu province. The procedure took 5 hours. Chen Jingyu also mentioned in an exclusive 2020 interview with Chinese media, "We have completed over 1,000 lung transplants, so this surgery is routine. We usually perform lung transplants within 2 or 3 days. That's normal." The hospital where Chen Jingyu and Hu Yang work is allegedly involved in the crime of harvesting live organs. In this context, Yokogawa, a China expert in pathophysiology and immunology, highlighted that transplant operations in the West have remained relatively stable recently. In recent circumstances, compatibility must be considered, and patients must wait for compatible organs. Dr. Chen Jingyu's statements could be seen as defending severe crimes allegedly committed by CCP officials. Yokogawa also analyzed that nearly all of the lung transplants mentioned by Dr. Chen Jingyu were experimental. The patient in the first case never left the heart-lung artificial machine ECMO system. The second lung transplant, which occurred in April 2020, was the most severe case chosen by Dr. Chen when Wuhan was under lockdown. This case was not the most urgent one requiring surgery. Despite many deaths in Wuhan due to COVID-19 infections and lack of accountability, Dr. Chen highlighted the success of the lung transplant. The logical explanation is that these individuals were being used for testing. Shanghai Lung Hospital, where Hu Yang works, was listed for investigation by the World Organization to Investigate the Persecution of Falun Gong, WOIPFG, on December 22, 2014. In May 2007, the Chinese Ministry of Health designated the hospital to specialize in lung transplants. From January 2003 to August 2012, the hospital performed 51 single lung transplants. The WOIPFG also noted that since 2000, many organ harvests from donors have taken place in hospitals of various sizes across China. Small specialized hospitals with adequate expertise have also begun performing human organ transplants. The surge in organ harvesting and transplantation in China coincided with when former CCP General Secretary Jiang Zemin initiated the alleged genocide against Falun Gong practitioners. On March 1, 2020, the WOI-PFG published the summary of the 2019 WOI-PFG investigation into CCP's crimes of live organ harvesting from Falun Gong practitioners. In this investigative report, the WOI-PFG continued phone investigations into Chinese medical personnel suspected of participating in live organ harvesting from Falun Gong practitioners. Since then, the WOI-PFG has gathered new evidence and leads, shedding more light on the alleged CCP live organ harvesting activities.